My name is Dr. Matt. I'm going to do your cranial nerve exam today. Can you please verify your first and last name and your date of birth? Okay. And can you please tell me what is bothering you? Okay. Any other symptoms? Are you having any pain? On a scale of 0 to 10, how would you rate your pain? Okay. And any other symptoms? Do you have any medical conditions that I should be aware of? Do you have any allergies? Are you taking any medications on a daily basis? How many milligrams? Okay. So you're here today to see a neurologist. That's me, and I will be testing all 12 cranial nerves. But first I will start with your vision, and after that I'm going to ask you to close your eyes, okay? Alright. Before I start with your vision, do you wear contacts? Okay. Okay. Are you bothered by very bright light? No. Alright. Then I'm gonna have you look straight right here in my nose. I'm going to shine a light in your eyes. We're checking pupil dilation. Okay. 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 Now I'm going to ask you to close your eyes. Close your eyes. And I will be applying a few drops. Those drops will kind of feel a little bit fuzzy. And so first you're going to fill them in your mouth. I'm going to ask you to open your mouth and stick your tongue out. So we're going to apply 3 drops of this, and you're going to feel kind of like a fuzzy sensation. That's going to heighten your senses and allow me to do a better examination. So go ahead and open your mouth. Say ah. 1, 2, and 3. Go ahead and swallow. Very good. Keep your eyes closed. And while the medication is going in your system, I'm going to listen to your heart. Okay, so go ahead and breathe normal for me, please? Okay. Okay. Going to switch and listen with the bell. Go ahead and breathe normal again. I'm going to ask you to take a deep breath in and hold it for 1, 2, 3, and breathe out. Good. And now we're going to check your lungs. Can you please take a deep breath in and breathe out? Good. And again, take a deep breath in and breathe out. All right. Okay, since you're now relaxed and you have your eyes closed, I'm going to take your blood pressure. I'm going to put the cuff on your right arm, if that's okay. Alright, so go ahead and pull your sleeve up without opening your eyes. Good. Okay. Good. Go ahead and uncross your legs and relax. Okay, let's go ahead and remove the cuff. Good. Okay, so while you have your eyes closed, I'm going to do a neurological assessment. We're going to check your reflexes first. I'm going to need you to relax your jaw while you keep your eyes closed. Okay, very good. Very good. 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 Relax your jaw again. Okay. Relax your jaw. Okay. I'm going to palpate your head for any lumps. Okay, and I'll palpate under your chin. We're checking for any lymph node enlargement. Make sure that you keep your eyes closed. I have here a tongue depressor. Tongue depressors usually are sterile and they're unique to each patient. So I'm going to open it, and this will allow me to do a mouth exam. When we're checking mouth, we're definitely looking for gag reflex and how uvula is shifting. If it's shifting left or right, then that would be an indication of some neurological problems, and if it stays midline, then that's definitely normal. So I'm gonna ask you to give me a big I'll put the tongue depressor on your tongue. Very good. So say ah. Good. Good. Keep on saying ah. Okay. Uvula is midline, and there's no redness in the back of the throat. But now I definitely need to assess your tongue. Okay, the inside of your mouth looks good. Alright, I'm gonna ask you to stick your tongue out. Make sure that your eyes are closed. And can you please move it up and down with your eyes closed, and now side to side with your eyes closed. And now can you please push with your tongue inside your cheek, just like that. Good. And on the other side, just like that. Very good. Okay. I have here one taste sample. This is going to go on your tongue, and I need you to identify the taste, okay? So it might be salty, sweet, bitter, sour. Alright, go ahead and give me a big ah. Very good. Can you swallow that? Okay, perfect. We have just a little bit left of this. So we're going to do the same thing. Go ahead and give me a big ah and swallow. Excellent. Okay. Alright, while you keep your eyes closed, go ahead and lift your chin a little bit up. I want to take a look inside your nose, see if there is any inflammation there. Okay, so keep on lifting your chin up. Okay. Okay, we're going to test your olfactory nerve. So I'm going to ask you to cover one nostril. Very good. And can you please take a deep breath in through your nose and out through your mouth? I need you to identify this smell. If you need to breathe in again, feel free to do that, but don't open your eyes, okay? Okay. that you keep your eyes closed. And now cover your other nostril. Can you please take a deep breath in through your nose? And if needed, you can go ahead and take another deep breath in. Good. What does that smell like then? Okay. Alright, so go ahead and breathe in, breathe out with both ears now. Very good. And can you identify that smell? Okay, excellent. I'm going to take a look inside your ears. Now can you please look right here for me? So turn your head a little bit. Okay, so make sure that you keep your eyes closed throughout the duration of the exam. Tympanic membrane is broken. There is no redness or irritation. Very good. And now I'll take a look on the other side. Looks that there is enough space for earwax to be drained. I'm not seeing any inflammation. And hearing should be intact. I'm going to take a look at your ears. I want to make sure that your hearing is not contaminated. So what I'm going to do is I will make some sounds in each ear, and I need you to identify the sound while you maintain your eyes closed. So okay, what about now? Okay, and what about now? Okay, and now? Very good. So let's go ahead and try that one more time. Good. What about now? Okay, excellent. And I'll be making a few more sounds. I need you to tell me how many times you hear that sound, okay? One time. Good. One time. Good. Good. What about now? And now? Good. And now? Okay. Very good. I have in my hands a tuning fork. It's 256 terahertz, and I will be making a sound, and I'll put the tuning fork behind your ear. I need you to tell me when you don't hear the sound anymore. So go ahead and tell me when it stops. No. Good. Tell me when it stops. No. Okay. Let's go ahead and do that one more time. Tell me when it stops. Good. Tell me when it stops. Good. A second test with a tuning fork. We will be checking two positions. Position number 1 and position number 2. Can you please tell me which position here is louder for you? So this is position number 1. And this is position number 2. Okay. This is position number 1. And this is 2. Good. And again, on the other side. This is position 1 and 2. Okay. This is position 1 and this is 2. Okay. You'll be hearing a few sounds. Can you please identify what object may be making that sound? Okay. Okay. You're right. I do have scissors in my hand. So the scissors are the ones that are making that sound. So that's good. Alright, go ahead and keep your eyes closed, and if you can please identify the object that's making this sound. You're right. So I do have here in my hands, it's a hole puncher. It is a handheld one. It's very easy to use. So this is what has been making that noise. Very good. Okay, next I will be checking your facial sensation. So we are moving to the face part where we have 3 nerve endings, one going to the eyes, nose, and mouth. So I'll be checking all 3 ramifications of those nerves. What I'm gonna do is I will touch you with this sharp. See how sharp this is? It's actually not really sharp, but it will feel kind of like a sharp sensation. So this is a plastic pointy object. I'm going to touch you, and when I'm done I need you to tell me how many times you felt the same touch. Okay, so make sure that you keep your eyes closed. Good. And please wait until I'm done and then tell me how many times. So you have to count and then tell me. Very good. Okay, how many times did you feel that? Good. And how many times did you feel it this time? Okay. And what about now? Okay. So we are going to retract this, and we're going to try a different object now. I have 2 objects in my hand. One is going to feel sharp, so it has lots of pointy, sharpy objects going to feel a little bit on multiple points. I'm going to show you on your chest what I mean by that. Okay, and then in my left hand I have a brush. The brush is going to feel dull, and this is what it's going to feel like. Okay, so make sure that your eyes are closed. Good. And I need you to tell me if you feel this sharp or dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. 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 Okay. Okay. And right. Do you have any questions for me? Okay. Well, in that case, you can go ahead and keep your eyes closed if you want to. And I'll give you a few minutes to take your strength, and if you want to sleep in the same position, that's fine. If you want to get up and do anything else, that's also great. I will leave that up to you. I think that we concluded all 12 cranial nerves today, and if you have any questions, I will be more than happy to answer them. You don't? Okay. Well, in that case, I'm going to let you relax, and if you need me, just let me know. Okay. Very nice to meet you.